Hey guys, we're going to do something a little bit different today. How about a vlog for the blog instead of just a blog? So for today, I wanted to bring you up to speed on some guidance that came out from the Department of Labor over the weekend, while you were sleeping, while you were keeping your social distance, and while I was celebrating my birthday on Sunday. We got some new guidance from the Department of Labor. And it is an addition to their question and answer page. I'll drop links in the actual blog post today, and I'm going to post this on YouTube, so I'll drop links in the description below the YouTube video. But I don't want to go through all of the guidance and repeat everything. I just want to go through some of the new stuff, and I'm not going to go through all of the new stuff. I'm going to try and pick and choose the stuff that I think is most important for you. So one of the things that the DOL clarified over the weekend is which employees are eligible for paid sick leave and expanded family medical leave. And we know that for paid sick leave, it's any employee who works for you. And for family and medical leave, it is the employees who've been working for you for at least 30 days. But what the DOL further clarified, and I think we kind of knew this already, is it's just for folks who are in the United States, and including the territorial employees. So if you have folks that are overseas and you're an otherwise covered employer, you have fewer than 500 employees, then you're not going to have to provide the paid sick leave or the expanded FMLA to anyone who is not in the United States. The DOL also clarified who is a son or daughter, and under the Families First Coronavirus Response Act, a son or daughter is your own child, which includes a biological, adopted, or foster child, your stepchild, a legal ward, or a child for whom you are standing in loco parentis. That's someone with day-to-day responsibilities to care for or financially support a child. So that is clarified in the definition of son or daughter. Another thing that I wanted to clarify, or the DOL did clarify, I thought it was pretty clear already, but let's give absolute clarification to this. If an employee takes leave, either expanded FMLA or emergency paid sick leave, and their job is eliminated in the interim, it's a business decision, has nothing to do, it's not retaliation for or in any way impacted by the taking of leave. It just so happens that the company makes a business decision. Does the employee have the right to come back to their position anyway, even though their job may have been eliminated or they may have been fired or laid off? And the answer is no. Employees are not protected from employment actions such as layoffs that would have affected them regardless of whether they took leave. Oh, here's another question that the DOL has answered. Does an employee qualify for COVID-19 leave if they've already used some or all of their Family and Medical Leave Act leave? So if you are an eligible employee, or if you have eligible employees who want to take paid sick leave, yes, they are eligible even if they've already taken and exhausted all of their 12 weeks of FMLA under Classic FMLA that covers employers with 50 or more employees. However, if it's an employee who wants to take expanded FMLA to care for a child who is home from school because the school is closed due to coronavirus reasons, and there is no child care available, the employee gets a grand total of 12 weeks of FMLA. So for example, if the employee has already taken 3 weeks of FMLA in the preceding 12-month period for their own serious health condition, they have 9 weeks left of expanded FMLA. Similarly, if they take 4 weeks of expanded FMLA now, they'd only have 8 weeks left for classic FMLA, their own serious health condition, to bond with a child. You know the drill. If an employee takes emergency paid sick leave act leave, does that count against other types of paid sick leave to which the employee may be entitled under state or local law? And the answer is no, they still have those. The DOL also answered the question, who is a full-time employee and who is a part-time employee? I know those definitions, well, there were no definitions in the statute. For purposes of getting paid sick leave act leave, PSL, A full-time employee is an employee who is normally scheduled to work 40 or more hours per week. Therefore, I think you can figure this out. A part-time employee is someone who is normally scheduled to work fewer than 40 hours per week. Here's another question that the DOL has answered. It is with respect to healthcare coverage. Here's the question. I've elected to take paid sick leave and I'm currently in a waiting period for my employer's health coverage. If I am absent from work on paid sick leave during the waiting period, will my health coverage still take effect after I complete the waiting period on the same day that the coverage would otherwise take effect? And the answer is yes. There are also some questions and answers having to do with the public sector. I'm not going to put those in this video, but you should if you work in the public sector or you're in human resources in the public sector. You should check out the Q&A to get the guidance there. What I want to skip down to is the definition of healthcare provider. I've been getting a lot of questions about that, and the DOL has answered what is a healthcare provider, and really it depends on the context in which we're talking about healthcare provider. So, who is a healthcare provider for purposes of determining individuals whose advice to self-quarantine due to concerns related to COVID-19 can be relied on as a qualifying reason for paid sick leave? So this dovetails into, when an employee wants classic FMLA, who is the healthcare provider that can basically certify the need for leave? And what the DOL says here is the term healthcare provider as used to determine individuals whose advice to self-quarantine due to concerns related to COVID-19 can be relied on as a qualifying reason for paid sick leave. That means a licensed doctor of medicine, a nurse practitioner, or other healthcare provider permitted to issue a certification for purposes of the FMLA. Now let's switch gears a little bit to the other definition of healthcare provider. Who is a healthcare provider who may be excluded by their employer from paid sick leave and or expanded Family Medical Act leave? And this is super broad, okay? Under the FFCRA, a healthcare provider is anyone employed at any doctor's office, hospital, healthcare center, clinic, post-secondary educational institution offering healthcare instruction, medical school, local health department or agency, nursing facility, retirement facility, nursing home, home healthcare provider, any facility that performs laboratory or medical testing, pharmacy, or any other similar institution, employer, or entity. This includes any permanent or temporary institution, facility, location, or site where medical services are provided that are similar to such institutions. So if you have someone working the front desk, if you have someone working in IT, if you have someone who cleans the front desk, if it's all part of a doctor's office, healthcare provider, nursing home, anything I've just read off that list, you do not have to provide those people with either paid sick leave under the FFCRA or the expanded Family Medical Act leave. Okay? And by the way, the definition is even broader. It includes any individual employed by any entity that contracts with any of the above institutions, the ones I just discussed. It also includes anyone employed by any entity that provides medical services, produces medical products, or is otherwise involved in the making of COVID-19 related medical equipment, tests, drugs, vaccines, diagnostic vehicles, or treatments. There's also a definition of emergency responder. We get that for the first time. An emergency responder is an employee who is necessary for the provision of transport, care, health care, comfort, and nutrition of such patients, or whose services are otherwise needed to limit the spread of COVID-19. Emergency responders and healthcare providers, employers can provide them with PSL and expanded FMLA, but they don't have to. And finally, for businesses with fewer than 50 employees, people have been asking me, Eric, how do we get the exemption? The DOL has said that if providing this leave may jeopardize the viability of our small business as a going concern, how do we get the exemption? What are the criteria? Here they are. 1, The provision of paid sick leave or expanded family and medical leave would result in the small business's expenses and financial obligations exceeding available business revenues and cause the small business to cease operating at a minimal capacity. So that's just one criteria. If an authorized officer of the business determines that that fits, then you can get the exemption. Here's another possibility. The absence of the employee or employees requesting paid sick leave or expanded family and medical leave would entail a substantial risk to the financial health or operational capabilities of the small business because of their specialized skills, knowledge of the business, or responsibilities. So if you have a key player who wants to take leave, you could deny that leave based on that criteria. And this is not, these are all disjunctive. So it's one or the other, okay? You don't have to have both. Here's criteria number 3. Again, 1 stands on its own, 2 stands on its own. Here's number 3. There are not sufficient workers who are able, willing, and qualified, and who will be available at the time and place needed to perform the labor or services provided by the employee or employees requesting paid sick leave or expanded family and medical leave, and these labor or services are needed for the small business to operate at a minimal capacity. That's a mouthful. I suggest what you do is head over to dol.gov and read this Q&A for yourself. It's pretty easy to absorb, and I'm just trying to summarize it a bit, and I'm also obviously reading from the Q&A too. I'm going to wrap it up here for now since we're going a little over 10 minutes. I apologize for the length of this. I'll drop links in the blog post today. Tell me what you think of these video posts. Is it too long? Should I just keep it in writing? But I'd love to hear your feedback. Otherwise, have a great day. I'll be back tomorrow on Tuesday. Thanks.